Alliance Live. Discover Digital Event, Part 1, Progress of the Discover Digital project so far, recorded on Wednesday, 12th of October as part of DigiFest22. What is the Discover Digital project? It is a project that aims to raise awareness of digital tools that can support your health and well-being, and it currently has 4 aims. So, skills and confidence, to equip people with the skills and confidence to make the best use of digital health and care tools in a way that promotes well-being, health, and independence. So what use is a device or a service for someone if they don't have the skills and confidence to use it, it won't be as effective, or they won't be able to access it. Digital health literacy, so increase digital health literacy in our target audience, and this includes empowering them to make a judgment call on whether tools are safe, secure, and scientific, avoiding fake news and untrustworthy apps. And this can be a large barrier to accessing digital health. And also, if you didn't know already, October is actually Health Literacy Month. And signposting, so collate suggestions of digital health and care tools from our third sector and NHS contacts and convey the information as appropriate to different groups. So we often hear from people that there's so much information out there which can be quite overwhelming for people to choose from, and outreach. So reach varied groups and involve them meaningfully in digital health and care related activities. And we have a strong focus right now on reaching seldom heard and minority communities, as it's really important to hear the voice and have them involved. Just a little background on Discover Digital. So it was initially launched in 2018 as Discover Digital for your health and well-being. And in between 2018 and 2019, it was delivered through a series of events, some of them were in partnership with science festivals in places such as Dundee, Aberdeen, Inverness, and Glasgow. And they offered interactive exhibits and workshops so the public could come along and try out different technologies from different sort of partners such as NHS, third sector, and private companies, and they could also participate in workshops and sort of have their say on things. And in 2018, this brought together over 500 people with lived experience and professionals of all ages. And in 2019, there was brought together over 700 people. And on show were digital tools that could help us look after ourselves better, self-management tools, digital tools that can help us look after someone else, caring tools, and digital tools that could help us access the NHS. And I've just got a few sort of screenshots or snippings here of the reports from 2018 and 2019, all of which can be accessed on our website. And the 2019 theme for that edition was self-management and care. So the workshops and showcases all focused on digital self-management. And the next slide here is just to sort of give you an idea of what these events were like. So there were different sort of exhibits and stands and stalls which people could go along to and sort of try things out. We've got one in Dundee here, and then things like VR headsets, and also I think over here we have the Chartered Institute of IT, and they could also see some sort of new sort of healthcare innovations as well. And just on to the Discover Digital Guide. So this is another piece of work from the Discover Digital project, and it sort of came about because due to the pandemic, I mean, with the 2018 and the 29 events, these were all large sort of events, as I said, you know, hundreds of people attended, and this sort of thing really was not possible with the pandemic. So the project had to sort of reevaluate and rethink its aims and how it was going to deliver the project. So in 2021, we developed the Discover Digital Guide as an online resource, and this is a PDF that can be accessed on our website. And why was it created? So the pandemic created an explosion in sort of digital tools available with the move to online. And so this made it even harder for people to know where to go, what tools to trust, what ones might work for them. So the Discover Digital Guide offers an introduction to the idea of using digital tools for health and well-being. And it tells the reader what these tools are and where to find them. It doesn't recommend specific tools for specific conditions. And these are just the various sections of the guide. So originally when the guide was published, it was one document, but we received feedback that this was a bit too sort of meaty, and we sort of split it into various different sections to make it a bit more sort of bite-sized and manageable for people. So the first section, how to use the guide, is fairly self-explanatory. Section 2, the big picture, it tells people what digital health is, some of the benefits it can bring, and also who can use digital health for their well-being. 3 is digital tools for self-management, so just explains to people what digital self-management is and the difference between sort of everyday self-management and normal self-management. And also just sort of signpost people to platforms where they can maybe access digital self-management tools. 4 explains the various different digital NHS services that are available in primary care, secondary care, and also NHS sort of self-management tools as well. Number 5, technology-enabled care, just explains what technology-enabled care is and the sort of various tools that come under this sort of umbrella, and also how to find support in your local area. 6 just sort of helps people to sort of stay safe when they're using tools, and also how to maybe know if a tool is working for them. And 7 contains various sort of definitions that are used throughout the guide. And recently we put the guide through a sort of readability tool called the Hemingway app, and it's just it's an online platform where you can just put text into, and it gives you a sort of readability score. So it helped us to make the guide more accessible and make it into, I guess, more accessible language and a bit more plain English as well. And this is just an example of what the guide looks like. This is a screenshot, so it's just page 2 of section 1 of the guide. And I'm just going to move now on to another piece of Discover Digital work, and my colleague Louise is just going to chat to you a bit about this.
Thanks, Maisie. I think, as Maisie said, the Discover Digital project had a long history of going out and engaging with people in their local community and organisations. So I guess in 2021, we decided that we were going to fund 7 organisations to engage with seldom heard communities. And our thinking behind was obviously it was in response to the pandemic, but also within the Alliance, the Digital Hub is a relatively small team to be covering a programme that's nationwide. So we looked at this as an opportunity to fund some organisations to engage on our behalf. And I guess what the Digital Hub team lacks in manpower, we have the support of and vast support of our membership and our membership organisations. So we're able to look at our membership and beyond to look at who could maybe engage with those seldom heard voices on our behalf. And what we really wanted to do was that we knew there was issues around digital exclusion and digital poverty, but we also wanted to understand what the barriers were to accessing digital health and care for these communities. So we knew that there had been some successes through Connecting Scotland and people using devices to reduce isolation and stay connected to friends and family during the pandemic, but we didn't really know or understand if there was any barriers in using these digital devices to access health and social care information or services. So that's what we were asking people to do on our behalf. So we did fund 7 organisations in the end, and that allowed us to indirectly engage with another 463 individuals. So for a relatively small budget, so it was a worthwhile piece of work. And we've got a short video that will tell you a little bit about each of those projects, who they engaged with, and some of their findings.
Discover Digital Small Grants Insights. Imagine a future where every citizen in Scotland can access care, information and support at the right time in the right way. To realise this vision is to include people in health and care development, particularly those involving new and digital technologies, to ensure that no one is left behind. Discover Digital aims to promote digital outreach, signposting health literacy, skills and confidence. By making relevant resources, information and support on digital tools more easily available. To ensure that our work addresses the right needs, we funded 7 projects to carry out citizen engagement over 2021. Community InfoSource spoke with refugee and asylum seeker communities to understand how digital tools might assist them in their health and well-being. Change Grow Live, Fort Valley Recovery Service engaged with people recovering from substance use to understand their needs in using technology to promote health and well-being. Deaf Equality and Accessibility Forum researched the accessibility of online health and well-being information sources. Happy to Translate, Trust Housing Association, spoke with older Chinese, Indian, Pakistani, Bangladeshi and African communities to understand the barriers and potential enablers that they face. Legowit engaged with people with long-term conditions to understand their attitudes and needs related to technology for self-management. Murray Wellbeing Hub focused on people living in long-term conditions, living in rural areas to understand their specific needs. PBC Foundation produced a survey to explore the uptake of their self-management app for people living with long-term liver conditions. Learning reports from each of these projects are being uploaded to the Alliance website. And we will continue to work with partners and stakeholders to share these rich and valuable insights, to tackle digital exclusion and to empower people to benefit from digital health, care and well-being tools. To find out more, go to the Alliance website www.alliance-scotland.org.uk.
So some of the key themes and insights we've heard were that digital must live alongside and complement face-to-face services. And this is supported by our digital human rights principles. We're not looking at digital services to replace face-to-face, but to offer choice and diversity in the services that we can offer. There are both positive and negative implications on privacy when using digital. We know that in some cases people prefer to access services in the privacy of their own home, but again there's downsides and negative aspects if those homes are not offering a safe private environment for health and social care services. There's a need for better signposting to trusted online information tools and services. Again, this is something that Discover Digital looks to support, to ensure that we're signposting people to trustworthy sites and ensuring that people are getting access and signposted to the right information, because there's a lot of things available on the internet that isn't always correct information or appropriate for a person. We offer digital training and support must target both the learners and the teachers, so that we're looking at a whole range of digital training that is accessible to everyone and that can provide kind of insights to these key themes. So one of our small projects that was awarded money through the small grant was Happy to Translate. And we're just going to, we had a short interview. We asked them what they found from the project and what it meant to them. So just to go through the responses to give you an insight into what it was like. We asked them, what made you apply for the small grant scheme? And they said, we keep our eyes and ears open for any opportunity to help other agencies reach out to ethnic minority groups, to include their voices when shaping policy and making strategic documents. Happy to Translate had heard about Discover Digital Grant Scheme, and we're keen to air the views of ethnic minority older people, knowing already from previous consultations the disproportionately detrimental effects of COVID on these communities, particularly among those who relied on community services for language support. And again, that was our thinking behind the grant scheme, that we're reaching these communities that we wouldn't be able to engage with during the pandemic without the support of organisations. We asked them what was the biggest barrier for the people or communities that you engage with to digital health, and they identified language as being the greatest barrier for those who participated in the consultation. They found that although they could use translation apps, etc., that medical terms and jargon didn't translate very well, and it didn't give people accurate information. They were aware that if people they spoke to had a smart device, ethnic minority older people very often use same routes to communicate with friends and family members. Using the devices to look up new information or to book appointments or renew prescriptions is challenging, particularly when factoring in the language barrier. And what findings surprised them the most was, they said, we have extensive experience working with the ethnic minority communities over the years, so there isn't very much that can surprise us at this stage, although we have to admit their level of enthusiasm to learn new things is always a surprise. And I think that's one of the things that we've been engaging with different age groups and target populations around accessing and using digital devices, that we can't presume that younger people are tech savvy and that older people are not. There's no assumptions are not helpful. And has Happy to Translate managed to apply any learning from the engagement? They answered, we know that introducing new ideas to ethnic minority older people takes time and a lot of repetition. We're keen to start working with these groups to show the limitless possibilities that will empower them to manage their own health and well-being, or that of someone in their care.
Thank you for watching the progress of the Discover Digital project so far. Showcasing the emerging issues, good practice and innovation of health and social care. Alliance Live.